My name's Heath Adams. I'm a cardiologist. I've been back in Hobart, Tasmania for the last 5 years. I'm currently the Director of Structural Intervention at the Royal Hobart Hospital. I'm also VMO at Hobart Private Hospital, and furthermore affiliated with the Menzies Research Institute. My role as an interventional cardiologist and a structural interventionist is to perform STEMI procedures to the Greater Hobart area. Furthermore, I'm involved in the intricate workup and leading the structural heart team. And in the south of Tasmania, we perform TAVI, we perform mitral edge-to-edge repair, we also perform left atrial appendage occlusion, and a variety of other interatrial septal defect closures. My career turning point was in 2016. I was a senior fellow at the Royal Hobart Hospital after doing my cardiology training mainly in Melbourne. But being a Tasmanian, the local heart team identified that TAVI was currently not available in the local space. At this point, I was encouraged to go away and perform 3 years of interventional and structural fellowship, both locally and overseas, and I was able to be supported by a University of Tasmania scholarship. This allowed me to gain the experience, both clinically and from a research perspective, to run my own program, which commenced in Tasmania in 2020. Since this time, we've had over 450 patients treated with a TAVI procedure in Hobart, with outcomes either at or better than the national average. It's really fascinating the ability that artificial intelligence and further automated systems are allowing us to improve outcomes for patients, particularly with structural heart interventions, whether it be TAVI or left atrial appendage closure. There is the ability with multiple platforms to be able to perform patient-specific modelling based upon CT-derived measurements. What we can basically do is match a patient's anatomy to the appropriate, whether it be valve or prosthesis relative to size. The area that we aim to implant can be superimposed during our fluoroscopic procedure, and patient-specific modelling really is a really excellent healthcare tool which has improved the procedure for both the clinician and the outcome for the patients. Furthermore, we do have some local research with one of our trainees looking at the role of AI in its ability to allow for a chest pain assessment, and we're also doing the same for looking at patients' tailored specifics for TAVI interventions. I think this area is fascinating. I think our enthusiasm does need to be tempered, however, and it's important to evaluate all AI models before allowing it to be used by the masses. Perhaps one of the more exciting projects is same-day discharge for TAVI, which has not been performed in Australia. This is currently used in the US to improve bed flow, particularly with the evolution of COVID and the restrictions we're seeing around public hospital utilisation around the country. We're trying to really revolutionise and streamline patient treatment, not just in TAVI, but also in patients who undergo stents. Currently, at the Royal Hobart Hospital, we perform same-day discharge for PCI for our elective stenting patients, but we're also moving into this space for patients who satisfy the criteria and are safe to undergo same-day discharge post-TAVI, and that's the current really exciting project we're working on, which has not really been performed or published in Australia. My work is exceptionally fulfilling. I'm able to follow patients through their cardiovascular journey. Now, that can involve young patients who are trying to perform what's called primary prevention or reduction in heart attacks. In patients who present to hospital later in life with what we call acute coronary syndromes, I'm involved in the intricate both inpatient and outpatient care. And furthermore, with our structural heart disease patients who are mainly elderly, we're able to take their symptoms and improve them with a simple overnight procedure and improve their quality of life and hopefully their length of life. I think it's important to emphasise that healthcare is a very dynamic career. In my 20 years since being a medical student to now, the whole field of cardiology has revolutionised not just in the interventional space, but in the EP space, the heart failure space, and also in terms of paediatric cardiology. I think it's important to know that it's a very dynamic career. It's multifaceted, so one day is not the same as the other, and that variety allows for really that variety of experience I really enjoy. Furthermore, the altruistic benefit of treating patients who are really unwell and being able to treat them quickly and improving their quality of life and improving their overall life expectancy really is a fantastic, it's one of the best things we can do. This is not just done by me. I work in a big team, and I think that healthcare as a whole always involves team members. There's no one day when I don't need at least 1, 2 or even 10 people to help me in the delivery of healthcare service delivery to our patients. And I really enjoy that social aspect, which really allows you to ride the highs and also to deal with the lows when sometimes we have poor outcomes. Well, I'm a father to 3 young children who are all under 7, and my wife's an anaesthetist, so we have a busy household. But I really do enjoy downtime outside of work, namely playing with my children. But I think it's really important when you work in healthcare and you work in a very intense field to be able to switch off. My way of doing that is performing cycling, running, gym work, really trying to switch off, which I think allows for a little bit of a brain reset and allows you to tackle the next day no matter how difficult the day beforehand was. I'm still a struggling golfer, and certainly over the summertime really enjoy the golf courses around Tasmania, which is becoming a real hotspot for golf. And then also socially, in Tasmania we have a wonderful network of local clinicians who catch up regularly. I'm also involved in some national and international collaboration with industry support, and this allows us to establish links all over the world. I performed my fellowship in the UK, and this has fostered a real thirst for travel, and I'm looking forward later this year to take both a working and a working holiday to Europe to further advance skills and clinical exposure.